All right, good morning, everybody. On Saturday, June the 20th, this is DAV Arlington-Fairfax Chapter 10, coming to you with yet another one of our online meetings. And this morning, we're going to have some information to share with everybody in reference to some updates on COVID-19 throughout the state of Virginia, as well as VA, and updates on what's going on within VA, DAV, and Chapter 10, as well as covering a few legislative issues that are still cooking out there. So just to reiterate, this is not a Chapter 10 business meeting. We will not be voting on any issues or discussing proposals of any kind. This is solely a meeting to disseminate information for our members. We will not take any questions during the presentation, but if you have something to think of or comment about, write it down and keep it to the very end, where we will have a little Q&A session for everyone to be involved in. This morning, the meeting will be led by those two handsome gentlemen. Yes, that is your Commander, Tom Wendell, and always your Adjutant, Shane Lehrman, which is me. So, before we get underway here, I was going to ask Commander Wendell if he had any words of wisdom to get us kicked off with this morning.
Well, thank you for that fine introduction there, Shane, and welcome everybody. I want to thank you for spending your Saturday morning with us, and hopefully we can give you some good information. Hopefully everybody is being safe out there. A lot of you have had an opportunity to participate in our commanders' chats on Saturday mornings and Sunday evening. So we appreciate those that have been able to participate in those. And, you know, it's been nice to see those people that have been able to participate, you know, just talking about things, you know, just being able to socialize with each other and see each other. So I thank you for that. And once again, thank you for being here, and soon, hopefully soon, we will be back together in person. So we will talk about that later. Shane, back at you.
Thank you, Commander. All right, we'll go ahead and keep moving along here. Our agenda of items we're going to talk about this morning, we're going to go over some COVID-19 updates, specifically on the state of Virginia, the Washington, D.C. VA Medical Center, VA claims and DAV National Service offices around the country, and we will also be discussing the National Cemeteries. They've had some new announcements, as well as updates on DAV, the national organization. We'll be talking about the COVID Relief Fund, virtual job fairs, national convention. We'll be discussing a few legislative issues, and Chapter 10 updates, and then at the very end, we will have a little Q&A session for everyone to participate if they have any questions. So to kick us off, what is the current status in Virginia for COVID-19? And that means this part of the conversation is going to be led by none other than Commander Wendell.
Thank you, Shane. All right, what's the current status right now? So first off, a couple things just to remind you, make sure you're taking your medications, make sure you're ordering them on time, getting them there to you on time. Make sure you're washing your hands and social distancing. Limit close contact with others outside your household in both indoor and outdoor spaces. So, things that you've seen every day on the television from every news source, the CDC, please continue to be safe. Okay. Next slide. Virginia's situation update. Virginia has entered phase 2, so social gatherings from 10 to 50, restaurants open to 50% capacity, fitness centers open 30% capacity, social distance practices and requiring masks and face coverings while indoors. Now, when they did the entered phase 2, we were looking at possibly, having an face-to-face meeting, but we made a decision not to do that. So that's why we're doing the information meeting today. and more information to be talked about later in reference to the actual chapter. Thank you. All right. COVID-19 cases in Virginia. Right now, total cases, 56,793. Total hospitalizations, 5,797. And unfortunately, total deaths, 1,602. Now, Virginia is trending down, so that's a positive thing for us. We're not one of those states that are starting to trend back up. So continue to do your social distancing and wear your mask and things, and hopefully we can keep Virginia safe. So next slide, Shane. So here's some resources for you as far as Virginia Department of Health, Virginia Phase 2 opening. You can go online, check those out, read them, get a lot of good information in reference to the coronavirus and what's going on within Virginia. So,
if you feel the need to capture that information this morning, might not be a bad idea to do a screenshot or take a little picture if you want to make sure you get those links. But again, we will be recording, and hopefully they will be available on the website shortly.
Thank you, Shane. And with that, the next subject is going to be the current status of Washington, D.C. VA Medical Center, and Shane is going to take over that subject.
Thank you, Commander. All right, I know you're sitting there thinking to yourself, what's going on at the D.C. VA Medical Center? Well, I'm glad you asked. Currently, all D.C. VA medical facilities are operating normal hours with the exception of the community clinic located in southeastern Washington, D.C., which is temporarily closed. Before you visit the D.C. VA Medical Center, where the majority of our members in Northern Virginia go to get their health care, make sure you're aware of some of the following information. For example, if you have symptoms of fever, cough, or shortness of breath, call the VA at 202-745-8000. Pick option 3 before you go there. They do not want anybody who may potentially be symptomatic coming to the medical center. And you can also get a telephone and virtual care primary care appointments. They are available for routine and non-emergency care as well. To help prevent the spread of COVID-19, patients and visitors are required to wear a mask or cloth face covering when visiting the VA Medical Center or any of its community centers or clinics. If you don't have a mask, one will be provided for you. That is fairly new. Up until recently, there was some limitation on some of the supplies of masks, but if you don't have one when you get there, they will provide one for you. Also, in reference to the DC Medical Center, valet parking has been suspended, so there is no valet parking if you drive to the medical center for care. They have self-parking available for all patients and visitors, and a shuttle service will be provided to and from the patient and visitor parking lots, parking garages, and the patient parking lots. For the safety of patients and staff members, the visiting hours there for inpatients have been suspended until further notice. Exceptions may be made for loved ones of patients on hospice or palliative care or deemed bedside essential. So, long and short, valet services have been suspended and they're not allowing any visitors to the inpatients at the medical center unless there is a special exception. We provide a ton of additional information if anybody needs this. The Veterans Crisis Line, what they've been noticing is a lot of veterans are experiencing increased anxiety and stress during this time, whether it's because of the social distancing and staying at home, losing employment, families been affected and impacted by this. So please make sure you have this number handy for the Veterans Crisis Line. Also, there's the 24-hour nurse line at the DC VA Medical Center. So if you need to contact them about care questions before you go, the 24-hour nurse line is up there. And if you have an appointment and you need it changed, there is the information for you to contact the DC VA Medical Center to change an existing appointment. There's also the National Veterans Helpline that you can call. There's also the pharmacy refill for the VA Medical Center. If you need medications and whatnot refilled, there is 2 contact numbers for you to call to get them refilled over the phone. And if you have care questions, there's also the telephone care line that you can reach out and contact as well. To get more information, you can go directly to the Washington, D.C. VA Medical Center. There is their link right up there, www.washingtondc.va.gov. So you can go right to their website and get the majority of this information that we've just shared will all be found on their website. And then this is another great part that they have available on va.gov, and that is coronavirus facts, what veterans need to know. So there's an additional information that you can go out and seek if you're curious about what's currently going on with COVID-19 and veterans. Can I be tested for COVID-19? The VA does have the capacity to test. However, testing is based on many factors, including the severity of symptoms or other existing illnesses or conditions. VA is following CDC guidelines, and essentially that means they're only going to test those veterans who meet the criteria. So those who are suspected to be infected are the ones that are going to be tested. If you have no symptoms and are of any illness and you're asymptomatic, chances are they will not provide the testing at the VA Medical Center. So that brings us up to our next portion, and what a better guy to have talk about it than our commander and assistant supervisor of DAV's National Appeals Office, Tom Wendell.
Well, thank you, Shane. So what about VA claims processes? We get many questions about this as to, hey, can I still file a claim during this pandemic? How do I get in touch with people? So we're going to provide you with some resources, because as of right now, the VA regional offices are closed to the public. Many of them are across the country are starting to reopen. We have some of our people that are starting to go back into those offices, but right now you cannot go into those offices. So right now it's closed to the public. So if you need help contacting the VA, so you can contact the 1-800-827-1000 number and basically talk to accredited representatives, and that's going to be us. So, if you got questions directly with the VA, give them a call at the 1-800 number. And as noted, they're starting to reopen certain locations, and also doing some contract examiners are starting to see people again. So what you want to realize is if you had a claim going and they needed to do an actual physical examination on you, one that couldn't be done through telehealth, then basically they had to wait until the pandemic is over in order to schedule those exams. So some of them are starting to schedule exams again, but not every place is doing that. So if you have a claim pending and you're waiting for your exam, unfortunately, we do have to wait for that exam results to come back before they can move forward with the claim. So next one, Shane. So also DAV National Service Offices. All DAV service offices are closed to the public until further notice to reduce transmissions of COVID-19. Right now, as you know, most of our offices are located in VA medical centers or VA regional offices. So until the regional office reopens and allows us to actually bring people into our offices, then right now you won't be able to see them face to face. And right now, if you actually call your local DAV office, you would more than likely get a recording that is referring you to the phone number below, because there's nobody in those offices to answer that phone. So what DAV's done is they've created this phone line that has approximately 90 National Service Officers on this line. So once you call, you're going to talk to a National Service Officer somewhere in the country. So just be aware that, you know, it is there Monday through Friday. So if you really need to talk to a DAV National Service Officer, this is a very important phone number for you to be aware of. So as noted, the phone number there is the 888-604-0234. That's to get any National Service Officer. Now, if you have specific questions of the Roanoke NSO office, they are answering their emails, so you can email them at their office email as seen here. Same thing with our Washington, D.C. DAV service office. You can see their office email, so they are responding to these emails. So, you know, if you have a question directly for one of those offices, reach out to them via their email. All right. So that's it for claims right now, and we will let Shane talk about the National Cemeteries.
Thank you, Commander, and what a well done job that was explaining the claims process, Commander. Thank you. So what is the current status at National Cemeteries? Many of you may be aware that on March 23rd, they closed all national cemeteries to any committals or internments. However, they have just resumed all committal services to accept 2 national cemeteries, and those are both in New York. Both of those will come online on Monday. Now, to be clear, the cemeteries are open for visitation, and they're now just restarting committal services in the last week or so. The National Cemetery Administration will contact families who were unable to hold a committal service due to the COVID-19 pandemic, and will help them arrange memorial services for their loved ones beginning in July. So if somebody was unable to be have an interment or committal service, they will start doing memorial services next month. If you want to get more information specifically about all national cemeteries across the country, www.sem.va.gov. Not only do they have a lot of the information I just shared with you, but they also have information specific to every national cemetery right on there. So if there's a specific location you're looking for, there's a place to find it. Plus, they also have an alert section where if there's any updates or changes, that will be posted there. Keeping in mind that not every cemetery is located in the same state or location, so there might be some local requirements or state requirements that may impact some of the visitations or committal services, or more importantly, the number of people who can attend them. So if you have any questions, I would make sure you check out those 2 sites, because that'll give you the most current up-to-date information for the National Cemetery Administration and the cemetery located nearest you. And that concludes the update on the cemeteries, and now we'll go back to Commander Wendell.
All right, thank you very much there, Shane. And next subject is, what is DAV doing during COVID-19? So, what is DAV doing? So one of the things that DAV created was the DAV COVID-19 unemployment relief in response to the unprecedented economic impact. So many people losing their jobs, due to COVID-19. DAV established the COVID-19 Relief Fund to provide help to service-connected disabled veterans who have lost their employment. So with that, it's a great program that they've started. And what they've done here is DAV's raised more than $2.9 million for this specific program. And so veterans that have lost their jobs, they've turned around and they're giving them a one-time relief grant of $250. Now, many of you may say, well, what's $250 going to do for anybody? Well, when you really look at the responses that DAV's been getting from some of the veterans that we've assisted with this program, they basically talked about, I was going to have to go get in, go to the local food bank because I didn't have groceries, and you just made it so I can feed my family, during this pandemic. You just made it so I can pay my electric bill. So $250 may not sound like a lot to you, but for those people that lost their jobs, that $250 has really helped them. Next slide, Shane. So as of right now, with this program, DAV's provided relief for more than 5,000 veterans. And, like I said, the responses that we've been getting from a lot of people have been tremendous. People have talked about, this help has really helped me in my time of need. I just got my job back, so I'll be taking care of DAV later. So, these are things that, DAV didn't have to do this. They didn't have to reach out and create this program, but it's a program that's been very beneficial to a lot of our veterans. And, they didn't have to be a DAV member in order to receive this money. So, it's definitely DAV reaching out to our veterans in need. So now, to determine eligibility for this program, you can see the link below. And so just go to that link and you can determine if somebody's eligible, and they can go right onto the website, apply right on the website. It's very easy for them to do. So next slide, Shane. Now, virtual job fairs, of course, DAV has been able to do their in-person job fairs because of the COVID-19 and the social distancing, so they've turned around and created a lot more virtual events. So next one, Shane. So when you talk about DAV's virtual job fairs, DAV, we have a partnership with Recruit Military Virtual Job Fairs, and so you can go right on there and go there and find the ones that are out there. If you know a veteran that's looking for a job, let them know. Go on to this virtual job fair, and some of them you got to be really ready for these things, because sometimes on these virtual job fairs, hey, they may be ready to interview you right there, so there's times where you want to be dressed properly even though you're going there virtually. So, DAV employment resources, you can go right on there and you can find a lot of different resources, talks about how to write a resume. There's many resources that are on there that can help people that are, veterans that are looking for jobs. And so next one, Shane. Now this one, we just came out with this one this week. DAV's National Convention for 2020 has been in Dallas, has been canceled, due to the COVID pandemic. National was really trying to make this happen, because it was our 100th our 100th year anniversary. But when you look around the country, especially when you look in Texas, the numbers of the coronavirus in Texas are really shooting up, and they had to make that hard decision, and to be with an abundance of caution, they decided to go ahead and cancel the national convention. So that affects a lot of things, as far as departments and things, but as far as national convention this year, it has been canceled. Now, the following, our next convention will be next year in Reno, so hopefully we'll see you all there. Now, so Chapter 10 will not need to vote on delegates for our national convention, since the national convention won't happen. And one of the main reasons that we were looking at actually having our face-to-face meeting today versus this meeting was, we were planning on it because we scheduled it prior to national, canceling the national convention, and we had over 20 national resolutions that we were looking at presenting to the department and then taking to national. But basically the national resolutions cannot be considered without the national convention. Therefore, Chapter 10 will not be submitting any national resolutions. All existing resolutions that were voted on at last year's national convention will stay in place. So, all you, Shane.
Thank you, Comrade Commander. Now it brings us up to what about what's going on in the world of legislation during this pandemic? Many of you may know I am the Deputy National Legislative Director for Benefits for DAV, and we're still actively engaged in a whole variety of fronts with Congress. While Congress was shut down, it seemed like for several weeks at a time, they are back on the Hill in various capacities, whether it's virtually or physically there. And as a lot of you know, they have passed several packages related to COVID-19 relief over the last few months. So where are we right now? Well, I'm glad you asked that. If you want to make sure you know where we are right now and stay in the know, you need to join DAV's Commander Action Network, or DAV CAN. Who can? DAV CAN. That's how that works. We will be releasing legislative campaigns through this. So anytime there is a new piece of legislation or a new bill that DAV can support based on our resolutions, we will send alerts and notices out through DAV's Commander's Action Network. You will receive them via email, and then you can contact your representatives and or senators and make them aware of that piece of legislation and ask for them to co-sponsor or support to help further our legislative mission. I know you're sitting there thinking to yourself, Shane, it would be great if you could tell us some of the current legislative alerts that have been going on out there in DAV. I'm glad you asked, Fred, because right there it is, right in front of you, some of the recent ones. This is HR 7111 or Senate 3899. This was a bipartisan bill that was just recently introduced and DAV sent it out through our Commander's Action Network. It is the Veterans Economic Recovery Act of 2020. Essentially what this will do is this will allow up to 35,000 unemployed veterans who lost their jobs due to the pandemic to be eligible for this new retraining program. One of the caveats is they cannot be currently eligible for any other VA educational program. So if they have eligibility for voc rehab or the GI Bill right now, they won't be able to use this program. What this program will do will retrain them into career fields that are currently in need during the pandemic and the crisis. They're looking at the 5 top careers that are available. And what this will do is this will provide up to 12 months of training for veterans to complete toward that new career field. While they're in the training program, they will receive a monthly stipend very similar to the post 9/11 GI Bill, and the VA will pay for the education through this program. If this is passed into law, this will only last for 17 months, and there will just be a 12-month window for veterans to be a part of it. It's a great idea. It's showing some initiative trying to get veterans without any other resources and availability for education programs to find a way to retrain them. This was sent out through the Commander's Action Network. You should have received an email if you signed up, but if you didn't, that's right. I'll back right up one slide, and there it is. If you want to go to DAV's Commander's Action Network, there's the link, www.dav.forum.us. What was that link, Tom? I'm glad you asked. It's www.dav.forum.us. To join DAV's Commander's Action Network and to stay in the know, that's where you go. All right, and there is another alert for us to talk about, and this is going to affect our survivors out there. This is HR 6933, Caring for Survivors Act. And I would really like to highlight this because this is a part of DAV's critical policy goals that we established at the beginning of this year to increase benefits for survivors. Our Assistant National Legislative Director, Jeremy Villanueva, who's also a member of Chapter 10, by the way, he led the charge on this for the last year and finally was able to get this bill introduced. And what it would do, it would increase the current DIC payments or dependency indemnity compensation payments. At one time, the rate was a little bit higher for those receiving DIC than they compared to the 100% evaluation than they are now. For federal programs, any payments made to survivors is 55% of what was being received by the eligible participant in the program. So in other words, for federal employment employees, the survivor would get 55% of what they were receiving. There's a huge disparity when you compare DIC to that. It's right around 40%. So this bill would increase the current DIC rates to make them 55% of the current 100% evaluation, which is it would be a several hundred dollar increase. It would also reduce the remarriage age. For some reason right now, if a survivor is 57, under the age of 57, she cannot remarry and keep her DIC benefits. Again, that is not within parity of other federal programs, so this bill would reduce the remarriage age from 57 to 55. I know it's only a 2-year reduction, however, it would make it more powerful to other programs that are out there, and it's a start to try to get it reduced. We'd like to see the remarriage age maybe eventually go away. However, not everything is that easy to get done. And the last thing it would do is it would reduce the 10-year rule for non-service connected deaths. You might be thinking to yourself, Shane, what's the 10-year rule for service connected death? Well, I'm glad you thought about that. Because if a veteran passes away due to a service connected disability, their survivor is going to be eligible to receive DIC. Or if a veteran is 100%, for 10 consecutive years prior to their death, regardless of the cause of death, the survivor will then be eligible to receive DIC. What this would do would reduce that 10-year to 5 years, and it would be a slight increase. So at 5 years, the survivor would get 50% of the DIC payment. At 6 years, they would get 60% of the DIC payment. 7 years, I'm a Marine, so I think the rest of us followed along, and I don't need to go all the way up to 10 years. So, all right. So that's what that did. This is a very important bill, and we're trying to get a lot of momentum on it. So, again, you should have received an alert from this if you are a member of DAV's Commanders Action Network. But if you're not, you can go to www.dav.quorum.us and sign up today and learn more about DAV's legislative initiatives. And here is something that Chapter 10 is incredibly excited about. Several years ago, we started a resolution campaign for state-level resolutions to change a specific rule within the state of Virginia. Some counties were allowing this, but our counties, Arlington and Fairfax, do not currently allow this. And what it is it will allow a veteran who's 100% permanently and totally disabled to receive property tax exemption on one vehicle. Right now, some counties around Virginia do this, not all of them. There's no standardization. So we pushed this issue for several years. It made its way through the Department of Virginia the last couple of years. And because of the department leadership that we have, to include our wonderful commander, Lisa Gregory and Denise Williams, PDC, they were able to get this issue pushed through not only once, but twice. That's right. It had to be voted on in last year's legislature, this year's legislature. It passed both. And now it will be on the ballot November 3rd. That is exciting. That means every one of you, that's right, should be registered to vote. And if no other reason, for you to vote in the election, you need to vote yes for this. There are other reasons to vote in the election. However, if you're not sure you want to vote, now I just made up your mind for you so you can make sure you vote in the election so that you can help get this through, because the state of Virginia already allows 100% permanently totally disabled veterans to get real estate exemption on their home. For those of us who live in certain areas around Virginia, especially Northern Virginia, it's not cheap to live around here if you're living solely off your 100% disability. So any property tax or real estate tax exemptions is a big deal. If you want to learn more about it, there is a link to the recent white paper that is available on the State of Virginia or Commonwealth of Virginia's JLC, Joint Leadership Council, so you can get more information. But make sure you're ready to vote come November 3rd, and we want you to vote yes. Which brings us to our next segment, and once again, Tom Wendell.
Thank you, Shane. Fine job on those legislative updates, and we appreciate that. And make sure you all get out there and vote in November, because this is very important. You may think that, hey, I'm not 100%, it doesn't matter to me. Well, one day you may be at 100%, or you may know somebody that's at 100%. So, even though this is, for veterans, make sure that your people in your household, know about it. People around your neighborhood know about it. When you're talking to people about the November ballot, make sure they understand they need to vote yes for that bill. All right. So let's talk about Chapter 10 now and what's going on with Chapter 10. So next one, Shane. So first thing is elections. Elections were not able to be conducted in April, so all current elected officers will remain in place through April of 2021's elections. And due to the fact that we did not meet, we've already talked to the DAV's Inspector General, Ed Hartman, and he has confirmed that that is something that we can do, so those officers are remaining in place until next year. So that means I get to be your chapter commander for another year. So hopefully you like that.
Everybody's on mute, Tom, so you couldn't hear the boos.
All right. So meetings and events will be determined on a month-to-month basis by the executive committee. We hope that we will be able to get together in July, but we're going to have to wait and see how everything's going in the state of Virginia, and we will make that determination. So we will look at that in the future. So now, no resolutions to vote on, due to the fact that the national conventions have been canceled. So we won't be voting on any resolutions right now. All voluntary events at the American Veterans Disabled for Life Memorial have been postponed through June. We're waiting for word from the National Park Service, and once we hear anything about July, we will let everybody know. If they determine it's safe for us to get out there, then we will get out there and do the cleaning of the memorial. It's best. Nobody's been out there for quite a while. We had our break for winter, and we would have started back up in May, but right now we're just going to wait, and we will get the word out to everybody as soon as we know it. As far as the department goes, department convention is still taking place, and I will be the chapter's representative at the department convention. And so I will definitely be there to represent the chapter and vote for anything that needs to be voted on. Thank you, Shane. Next one. So basically, if you're not following us on Twitter or Facebook, make sure that you're, logging in, following us on both of those social media sites. Jim and Shane do a great job keeping everybody updated on what's going on, and we greatly appreciate our social media presence. You guys are doing an outstanding job putting that out. And also, we have, watch out for our upcoming newsletters and any special releases. Shane does a great job with our newsletter. We greatly appreciate everything that you do with that, Shane. And, he puts out a lot of good information. So make sure that you're getting that. And all right. Well, before we go into any questions, I talked about the claims process, but one of the things I didn't talk about, and just want to bring it up real quickly since the assistant supervisor at the Board of Veterans Appeals office, our national appeals office, the Board of Veterans Appeals, basically any in-person hearings have been postponed until after the COVID-19 pandemic is over, but they are offering virtual hearings, and we're doing multiple virtual hearings on a daily basis in our office. And so if you got a veteran that their hearing got postponed due to the COVID-19 issues and they want to have a hearing, then have them reach out to our office and we can make sure that that happens. So, these are just like what we're doing right now. That's what you're going to see. You're going to see the judge, you're going to see one of our national appeals officers and yourself. So it looks just like what we're doing. So you can definitely have a hearing that way. And before we also get into questions, we do have a special guest with us today. We do have our, Department Commander Lisa Gregory with us today. Lisa, if you'd like to say anything to the group.
Well, first, Kevin would like to hear Shane do math again. He happened to be walking by during that little. The other thing on the virtual career fairs, since I am on the National Interim Employment Committee, speaking with the director, they've had 1,500 to 2,000 veterans attend those virtual career fairs. So lots of companies are still hiring. If you know of a veteran who maybe they got unemployed and now they're thinking maybe it's a good time for a career change, this is an excellent opportunity for them. Another easy website that you can access the veteran resources on there is just davjobs.org. That's kind of a little quicker than having to remember all the other. But yeah, the career fairs have been they're rocking and rolling. Lots of companies here in Virginia hiring online, and people are having a telework option. So even if you still can't travel, it's still available. So please encourage those that are going through a difficult time right now, maybe looking for a career change. This might be a good time. Thank you.
Thank you, Commander. All right, Shane, I'll turn it over to you.
Thank you, Commander Wendell. So I just want to say thank you to everybody for attending our meeting this morning. And we're going to go ahead and if there's any questions out there, we will get them addressed. And remember, we can't really discuss a lot of DAV Chapter 10 business. We can't bring up proposals or vote on anything. And if you have a specific question about your claim, please don't bring that up in front of God and everybody, because we don't want everybody to know your personal business, and neither do you. So before we get into that section, I just again want to thank everybody for being part of it this morning. Hopefully this will turn out well via the recording, and we'll be able to post this on our website. So with that being said, what I'll do to make this easy, instead of just everybody trying to jump in at once and ask a question, and everybody's going to blow each other out of the door with chiming in at the same time, I was going to go down the list, but I already see somebody with their microphone turned off and their hand in the air. So, Monty, I believe you had a question. What's your question for us this afternoon, sir? We can't hear you at all, Monty. Your microphone is on. but we can't hear you at all. Still cannot hear you at all, Monty. Your green button is on. It might be a setting within your computer not recognizing the correct microphone. Would be my suggestion. So, no, sir. So while you try to figure that out, I'll see if we've got anybody else out there with a question. Also, Monty, just to let everybody know, there's a chat feature on the toolbar for GoToMeeting. It looks like a little text bubble. If you're not able to get your microphone to work, you can text in your question there, type it in, and I will read it out for everybody so we can still get your concerns addressed, even though you might be having a few issues with your microphone. So while we're waiting on Monty, does anybody else have any questions or any topics, comments that they would like to make? Anna, go right ahead, ma'am. Yes, turn up. There you go.
Yeah. Can you hear me?
Yes, ma'am.
I was at the VA hospital on Friday, and just an FYI, they are screening people, kind of a brief thing as you walk in before you get to the atrium, and they have a more comprehensive screening set up before you get to the clinics. They're doing a good job. The chairs are spaced, so there's social distancing, and every other seat is blocked off so nobody can sit there. But there were very, very few people there to begin with, and I was in and out quickly. I think they're doing an excellent job. Can't hear you, Shane.
Thank you for the update, Anna. We greatly appreciate the insider information, especially being on the ground at the VA Medical Center. Before I get to Monty's question, does anyone else have a question that they want to ask before I address what Monty has sent in? Okay, I'll see what Monty's got here. Monty, just wanted to let everybody know that the VA Medical Center in DC said that you should wait until July 6th for audiology, dental, and eye clinics. And again, as we noted earlier, they are open and maintaining regular hours, and they are seeing some non-emergent cases. But again, as we also noted, they're asking that if it isn't an emergency, that they will schedule these things at a later date. Monty's question is about the 100% VA real estate property exemption. Actually, that's not what the issue on the ballot is. It's solely for the property tax for a vehicle. Currently, veterans who are 100% disabled qualify for real estate exemption. Now, you're asking whether that's the 100% of the taxable amount. I'm going to say yes, but I am not a tax expert or an expert on the benefit, but I believe there is the property real estate exemption for 100% permanently and total veterans. My best suggestion to you to get clarification, you can go to the Department of Virginia Veteran Services website. They have all of that information linked right on there, but I believe 100% permanently and totally disabled veterans do have real estate exemption on their home, real estate property exemption, taxes on their home. All right, let's see if we got anybody else out there with a question or a comment. We also have another special guest with us this morning, and that is the DAV National Service Office Supervisor in Washington, D.C. He became the supervisor there around September, October of last year. His name is Jeremy Yost. Jeremy's on the line with us. Jeremy, do you have any additional information that you would like to update the group on this morning, sir?
Thank you, Shane. Can you hear me? I can't hear anyone else now.
We can hear you, Jeremy.
Okay. So if you guys have any questions or have any issues with any disability claims like Shane stated just a little bit ago, don't be bringing them up here. You can always email us at that DAV email address for my office, and one of my 3 national service officers will help you out. On top of that, our TSOs are back in their offices right now. So if you have any service members in the Fort Belvoir or Quantico area, they'll be able to help them, just not face to face. But they're in the office. They can take phone calls. They can accept emails. They're just not going to be able to see clients until that base allows that to happen. Now, the website that I put in the chat, I apologize. It says it goes off your website. It actually goes off your zip code. That will actually tell you if they're doing compensation and pension exams in your area currently. And that's not counting just VA, that's counting contract examinations as well. So you want to look at that because you might be in an area where they will be able to do examinations for any disability claims that you have currently pending. Other than that, I have nothing else, Shane.
And Jeremy, we really appreciate you taking time to be with us on Saturday morning and providing a little bit more information in reference to the claims process. And I'm going to go ahead and throw them under the bus. If you have any other questions about your claim at any time, contact Jeremy. I will be posting his personal his personal email address and cell phone number on the website shortly. Call him at 2 or 3 in the morning. He enjoys that. So with that being said, I think we've addressed everything that we came to address here today. And I don't believe we have anybody else with any questions or comments. But I just want to ask a question. This is only the second time we've done an online meeting like this. So I'm just curious what the feedback is. Do people like this format? I know it's a little different than meeting in person, but if anybody has any comments on what they like about this format or don't like, feel free to share them with us. Just remember, we are recording this, so keep your profanity to a minimum. Tanya, that's all I'm saying. So anybody want to throw out any comments on what they think about the process that we are currently doing with these meetings?
I'm seeing some good thumbs up just for recording's sake. And then I appreciate you taking the time to collect the slides and the information all in one place, Shane. And Tom.
Thank you, Tanya. That's why I was going to say get an extra nickel an hour, but you don't pay volunteers. So that's how kind of that works. But I'm glad you liked it. I think this is a good format. We get out a lot of information and give everybody a chance to see it firsthand without having to have a meeting. And the last comment two last comments I want to make. Monty, only one person from each chapter is allowed to attend the department convention due to COVID-19. They put a restriction on that just to make sure. And as far as your question about property tax, there's a difference between real estate tax exemption and personal property tax exemption on a vehicle. So those are 2 separate things. Prince William County doesn't allow it on vehicles, neither does Arlington or Fairfax. That's why that issue on the ballot is so important. So,
Can I clarify? I think you have to understand the real estate tax is already in the Virginia Constitution. Property tax has been done by localities all this time, and we felt it was unfair to 100% disabled veterans, which is why Chapter 10 submitted the resolution. So what you're going to see on the ballot is actually a Virginia constitutional amendment for all localities across the Commonwealth to exempt the property tax for one vehicle. So that's what that is. I would highly recommend going to the JLC site and reading the full position paper for better clarification. Thank you.
And thank you. And yes, our Department of Virginia DAV commander just said that Chapter 10 not only Our resolution made a difference. Think about this. We affected the Constitution of the state of Virginia. We ought to be ecstatic about that. So I want to thank everybody for the work on those issues. That is awesome. Commander, I will turn it back over to you if you have any closing comments or anything else you would like to add before we call it a morning, sir.
Well, once again, Shane, outstanding job. We appreciate the comments from everybody. We appreciate you taking the time out to join us this morning. And hopefully you enjoyed what you saw. Hopefully you got some good information out of it, information you can share with other veterans. So that's what this is all about, is getting the information out to everybody. So we greatly appreciate everybody taking time to spend with us this morning. We ask that you all remain, continue to be safe. If you need us, reach out to us. If you're not doing anything on a Saturday morning or a Sunday evening at 7, jump onto the chat, say hi to us. We're just there to talk about anything. No DAV business. We're just talking about anything. And so things are going well, and I greatly appreciate it. And we will continue to get information out to you. And as soon as we know about next month, we will definitely let everybody know. And Shane, back at you.
Thank you, Tom. I appreciate it. And yeah, just to reiterate Tom's comment, we meet every Saturday morning at 9 a.m. on GoToMeeting. We meet every Sunday evening at 7 p.m. on GoToMeeting. We call it the Commander's Chat and Check-In. We talk about it a lot. We don't get a lot of people joining. Some nights we have 8 people. Sometimes we have 2 or 3. But I just want to talk about how important this really is to several of our members who some of them haven't missed one yet. A lot of our members, when you think about it, not only are we homebound because of COVID-19, but some of our members are even homebound because of their disabilities, their inability to get out of the house, or just wanting to keep themselves safe. They don't get out. I know that a few of our members have expressed through certain means that have gotten back to me, they look forward to those chats every Saturday morning and Sunday evening. It's their way to connect with their fellow veterans, because a lot of times they have nobody else to chat with except their spouses, and I think their spouses are already tired of talking to them, like mine is tired of talking to me. So if you want to talk to somebody that is excited to listen to your wonderful witty humor and clever stories, like Shane has, join in on Saturday mornings at 9, Sundays at 7. Get a little camaraderie going. I know several people on this morning's call have joined in with us on several times. And again, we don't talk DAV business at all, or politics or religion. We talk about what's going on, how is everybody doing. We've even had conversations about everything from grilling, cooking, restaurants, books, movies, and I think somebody even tried to have a conversation about the lost continent of Atlantis. That didn't go over well. I'm not sure who that was. So if there's things you want to know or just talk about or just engage with us, please consider showing up on Saturday mornings at 9 or Sundays at 7 p.m. and we can get that information. It's on our Facebook page. It was just put out again in our recent newsletter, a link for you to join us. It's the same link. So again, thank you all for coming. And unless anybody has any additional comments, I believe we have one. We got a couple of the way it looks. Hold on. It looks like Jim Pecuner has a comment, past chapter commander, past department commander. Go ahead, Jim.
Good morning, everybody. Just we've been putting out tweets all morning about this meeting, and I got a comment back on a direct message from another chapter, which I'm not going to say what the chapter number is, that said, "Wow, I just wish our chapter was near as advanced and as cool as Chapter 10. Great job."
That is awesome. Thank you, Jim. Appreciate that. And I'm not sure what chapter that is, but yes, Chapter 10 is cool, as you indicated. I believe our CSO, Chris Arrington. Chris, did you have something that you wanted to? Oh, you were just waving. Okay. I just want to make sure I didn't miss anything. So with that being said, as was noted, if you want to be cool like Chapter 7 or Chapter 10, not Chapter 7, goodness. you want to be cool like Chapter 10, make sure you're here. Make sure you're online. Make sure you're meeting with us Saturday mornings at 9, Sunday evenings at 7. And if you have questions, please feel free to reach out to us. And since I don't see any other hands being raised or comments or eyebrows being raised, I'm going to go ahead and call it, Commander. That is the remainder of our meeting. I'm going to stop the recording.